Hey everyone, welcome back to another edition of the Dental Assistant Nation podcast. My name is Kevin Herring. I'm honored to be the host of this podcast as well as the founder of Dental Assistant Nation. And I am thrilled today to have on a friend and a colleague, and we're going to talk about some things that are very important for dental assistants today. But first, I want to introduce you to Sophia Dunkley. Hey, Sophia, how are you?
I'm doing great, and I'm so excited to be here at Dental Assistant Nation. So this is awesome.
And I appreciate you coming on because you and I did a podcast together for the Speaking Consulting Network. You and I are both members of that, and you were very adamant that you wanted to talk to the assistants. And so I really appreciate you doing that. Thank you so much.
Yeah, absolutely. It's my pleasure. Dental assistants, they're a passion for me. And primarily because when I started in dentistry back in 1994 out of college, I worked as a clinical assistant as well. So I did both clinical and front office in order to be able to support the office that I was working in. So I know the role of a dental assistant. I know the challenges, I know the struggles, and I know how that role has evolved over the years. So it's very passionate part of what I do and how I train.
Well, you gained a lot of fans just with that right there, I can tell you. So that's awesome. Hey, you gave us just a little bit of a background there, but I want to make sure our audience knows a little bit more about you before we dive in today.
Sure, absolutely. So I'm a practice management coach and consultant, and I have a particular focus on case acceptance for the dental practice because I am a firm believer that case acceptance is the nucleus of the dental practice. So I coach and support my offices in basically what are the proper verbal skills and systems to be able to get the patients to say yes. But I also work on all the necessary systems needed to get a practice to be successful. Been in dentistry since 94 and I've been consulting since 2000.
Well, and like I said, I'm honored to have you on. I'm thrilled to call you a friend as well as a colleague. And let's talk a little bit about that case acceptance because we know the big role that dental assistants play in those patients saying yes. And I guess the first thing I wanted to ask you was how do we make sure that those assistants that maybe aren't comfortable getting patients to say yes? What are some things that they can do to kind of build up belief in themselves and kind of have that faith in themselves that they can actually do this part of the job as well?
Yeah, absolutely. I am very passionate about empowering dental assistants in order to feel comfortable to talk and take part in the case acceptance process. The dental assistant role is one of building trust and building relationship. And part of what I train is always relationship before money. And so that dental assistant role is so important. They create the connection, they create the relationship, they uncover some of the things that the patients are not able or willing to say to us. So when I have a dental assistant that's shy around that, I love to pour into them and help them become empowered, let them know the value that they bring to the dental practice setting, and also support them with the verbal skills, also with systems on, when a situation, when this happens, you do that. When a patient say this, you do that. And that helps to just build that trust for the patient, but also for the dental assistants to work with me to create that type of a relationship. So it's imperative that I'm able to help them with the verbal skills and help them become confident. So yeah, so dental assistance as part of the case acceptance process is very, very powerful and it helps with building the relationship and what I like to call the stickiness to the practice.
And is some of that lack of confidence whenever a dental assistant is in the case acceptance world, is that from a worry about that the money conversation is going to come up? Is that what you see more often than not?
Yeah, so it's a worry about the money conversation and the patient being overwhelmed or the patient rejecting the discussion about money. And so no one wants to have this very personal and private conversation because they're worried that the patient may not like them or may not feel comfortable around them. And so a lot of us as human beings, we don't realize we have something called approval addiction. And
Yeah.
so if we are not accepted or a patient is a little uncomfortable, we take it super personally. And sometimes it's just that the patient really wants the dentistry, but they just feel vulnerable, right? Talking about your personal finances with someone you don't know
Sure.
puts you in a vulnerable position. And so dental assistants usually have that extra relationship, that additional connection that make them the perfect person to be able to have that conversation. But they need to be supported. They need to be given the tools. They need to feel that this is okay. And if the patient doesn't say yes, there are words and phrases you can use to help the patient work through that.
All right. Well, you teed that up nicely. Let's talk about some of those words or things that you would give as tips to dental assistants to maybe get a little bit more confidence in what they're presenting to the patient.
Yeah. So I am a big proponent of making sure that we are showing our patients what their condition is like. So a dental assistant can be the perfect team member to tee up the whole process and show the patients the before and afters of a condition that is very similar to them. And the verbal skills that support that would be, mistress patient, I know you came in here and you stated that these were areas of concerns and you wanted some solutions. If you don't mind, I would love to show you some cases that are similar to yours and how we were able to resolve cases like that in our practice. And I can also show you cases of scenarios where patients did not move ahead and what happened. And they could be very instrumental in that process. Another verbal skill that we can utilize is finding the patient's values by asking the patient, how important is it for you to have the highest level of health and prevention? And then educating the patient on how that impacts their quality of life as they go through life. So, training a dental assistant to be able to have that conversation while they're in the room together is extraordinarily powerful.
I love some of those ideas. One thing I wanted to ask you was we know that there are different personalities at play in the dental practice. The assistant may be different than the doctor or the financial coordinator. How does everybody in the practice get on the same page, even though the personalities may be different whenever it comes to case acceptance and treatment presentation?
Absolutely. This is very, very key of getting everyone on the same page, especially in the aspect of building trust and relationship and creating value for the dentistry. It's important to have training often. One of the number one things I learned after doing this for so many years was that we were not investing enough time in training and supporting the team members and taking into consideration different personalities and different stress responses. If you've ever done a DISC personality assessments or a strength personality assessment, you will be able to understand your team members better. And I feel that when people have an understanding that is not just an opinion, but something that has a little bit of a scientific support to it, they can embrace each other's shortcomings better. Or if someone's not having a great day. So understanding stress response and how that impacts the entire patient process, but also how it impacts our relationships in the office is key. And so I think that is a powerful, powerful tool to have in a practice. But training every week with the dental assistants, verbal skills, giving them recognition when things go well. It is very, very important for the dental assistants to basically be taught how to active listen and do active listening, training, and verbal skills, but also providing reassurance for the dentistry that the doctor is providing.
Is this something that the dental assistant needs to ask the dentist for the training? I mean, how does the training come about? I'm curious, who instigates that in your mind?
So I think training is going to be initiated primarily by leadership. That's going to be the dentist or the office manager or whoever the team leads are. But if your practice does not have that kind of support, then you step in and say, hey, doc, I would love to be able to help you more in the case acceptance process. What tools, what support can you offer? How can we work together to make sure we're all aligned on the same page? And I learned the verbal skills that you have. So I will say what you would say. And we're using similar language throughout each contact point in the practice.
And I want to go back to something you said earlier where you were talking about that you could show examples of dentistry where the patient went through with something and it paid off well for them. That's such a great time as well to reinforce the value of that doctor's clinical skills or how much faith you have in that doctor and maybe even why you work there as well.
Absolutely, absolutely. And one of the powerful things also I think we sometimes overlook is showing the patient the work, photos of the work that the doctor just did. Even if it's just a quadrant, even if it's just a crown, it creates value and it sets up for the next step. But it also creates credibility for your dentist because patients are not used to seeing their teeth like that.
Sure.
So they go home and they're talking with their family at dinner, they're at an event, they're like, "I can't believe this doctor just worked on this crown for me. Look how amazing it is." But you, the dental assistant, foster that to happen because you utilized your time to be able to create that value for the doctor's dentistry.
So I know we've talked about some of the good things to do in case presentation. What are some of the things we should avoid whenever it comes to case presentation?
Yeah. So one of the primary things we want to avoid when it comes to case presentation is really understand that in the clinical setting, when we're creating value for the dentistry, there is no such words as it's a tiny fill-in, or it's a little small decay, or it's a little crown. We want to make sure we're using terms that are patient-friendly, but will create urgency, but also value for what we're doing. So I like to use words like the tooth is weakened, right? Very hard to challenge. This tooth is weakened. This fill-in is weakened. We can strengthen this tooth by restoring it with a crown or an inlay or an onlay, right? So what the words we choose is important.
And that's such good information. I mean, words matter. And we think about words in the practice where we're talking to each other, but we don't think about when the patient's listening so often and just those choice of words, what an impact that can make.
Yeah, yeah, absolutely. I had to learn that. And also, choosing the right words can diffuse an unfavorable situation or an unfavorable results, right? Even when a patient is a little upset or a little disappointed, learning to ask open ended questions rather than questions that could be answered with a yes or a no can allow you to dig deeper and uncover what the true underlying issue is, right? Sometimes patients are embarrassed. Sometimes they're phobic. Sometimes they don't trust. And we're not sure which of those that's getting in the way. And we think, oh, this patient is a PIA. No, sometimes we just want to ask deeper questions and we'll find out is they're really worried that this might hurt, right? Or they don't trust because they didn't really understand. Or, there's a miscommunication that could be easily resolved. So it's really, really important to have the support and the freedom to be able to have those conversations.
And last question for you. What, in your opinion, does the handoff look like between the dental assistant and that financial coordinator or the next person in the process whenever it comes to case acceptance? How much information should the dental assistant be sharing about the conversation he or she just had with the patient?
Oh, yes. The handoff is like the most important step in the entire patient journey. And so, as we know, there are handoffs from the doctor to the dental assistant, from the dental assistant to the financial treatment coordinator or front office, or it could be vice versa, the dental assistant back to the doctor. So, it's very key that we clearly state. So, Dr. Jones today saw patient Snow, and Mr. Snow is excited about getting his teeth taken care of. He wants to preserve his teeth and he wants to be healthy. Doctors has recommended a root canal post and a crown to save this tooth, and patient Snow has decided that they want to go ahead with this right away. We've agreed we're going to see the patient in the schedule next Tuesday or whatever time works best for him. But Doc has stated that it's really important for him to get this taken care of as soon as possible. Snow, I'm going to see you next week. Sophia's going to take good care of you. Sophia's going to help you with all the payment plan options that we talked about that we have available in the office. See you next week, Thursday.
I love it. And I love the fact that you're reinforcing everything that was said and everybody in the room is hearing the same thing. I mean, that's
Yes.
fantastic. Very short, sweet, to the point. That's great.
Yes. And if you think about it, I talked about values, created urgency, reconfirm what the doctor said, put in a little bit of connection to the patient. We had a good time and we did, but created the urgency. Let's get them in next week. So I've just filled a lot of gap for that financial coordinator. All she has to do is then say, sure, I'm going to go ahead and take care of this patient. I'm going to be sure to get patient Snow in next week, Thursday or sometime around that time. So I'm also stacking my schedule as well as I'm doing the handover.
Love it. And I love that you have that background with dental assistants and you work with so many dental practices on this type of thing. So I'd love for audience to know, where can they learn a little bit more about you? How can they reach out to you? Because I think the words that you said are going to have a lot of questions come after them for assistants who want to up their game whenever it comes to case acceptance.
Yeah, absolutely. And I try to make myself available to help in many ways through Zoom calls or come to offices directly or just phone calls, however I can help to support. But I can be reached at directly on my cell at 347-577-9102. You can also send me an email at Sophia at thepracticenavigator.com. You can also go to my website and send me a form at thepracticenavigator.com, or just go to LinkedIn and send me a message at Sophia Dunkley on LinkedIn.
One thing about Sophia is not hard to find, and that's a really good thing. And we're going to put every one of those links and all the information in the show notes. So it's real easy for you to get a hold of Sophia and take that case presentation, case acceptance to the next level. Sophia, as always, it's a pleasure to talk to you. Thank you so much.
It's my pleasure. And Dental Assistant Nation, I love it. I would love to come back whenever you want me. So please, it's been a pleasure.
Let's count on that in 2025. I'm great with that. Absolutely. Let's make that happen.
Absolutely. Thank you.
Absolutely. And thanks to all of you who've listened to this episode of the Dental Assistant Nation. Hey, clinical skills are great, but communication skills, that's where so much of the dental assistant's possibilities and opportunities for success lie. We want to make sure that you have all the communication tools that you can to succeed. Until next time, it's Kevin Henry, host of Dental Assistant Nation and founder as well, signing off. And as always, wishing you nothing but success ahead.